Approximately 15% of couples have difficulty conceiving. Of these, around a third will be due to male causes, a third female causes, and a third will be a combination of both. The most common cause of male infertility is low sperm count or poor sperm motility. Sperm count, motility, and shape are assessed in a semen analysis that's performed under the microscope. The total number of motile sperm are calculated using this volume, count, and motility of the sample. This should be at least 40 million. The normal ranges for a semen analysis are determined by the World Health Organization. In a semen analysis, a test for anti-sperm antibodies might also be performed, as these can appear normal fertilization. It's normal for sperm count to vary from day to day, especially during periods of stress or illness. For example, someone who has a count of 20 million per mil and then 30 million per mil the next time might feel that this is a big increase, but it's most likely just due to day-to-day variation. Another person who has a sperm count of 4 million per mil and then another test of 2 million per mil might be worried that their count has halved, but this is probably just due to day-to-day variation also. Some men feel worried when they're told that they have a high level of abnormal sperm, but up to 95% abnormal is still considered okay according to the World Health Organization. Male infertility can be genetic or can also be caused by physical or psychological problems. There are some lifestyle factors that can help to try and increase healthy sperm production. Smoking can cause a big decrease in sperm count and motility, so not smoking is really important. It's also good to avoid prolonged use of recreational drugs and limit alcohol and caffeine intake. Sperm is susceptible to high temperatures, so it's best to avoid sitting for long periods of time and wearing tight underwear. It's also good to avoid environmental toxins such as paint and pesticides. Obesity can decrease sperm count, so it's important to maintain a healthy weight, eat a healthy diet including lots of fruit and vegetables, and do a moderate amount of exercise. There are also some male antioxidant supplements that you can take to try and increase the quality of the DNA inside the sperm. Regular ejaculation every 2 to 3 days can also help with this. Sometimes, despite best efforts to improve lifestyle, no difference is seen in the quality of the sperm, and it's important not to blame yourself in these situations. The most common treatment for male infertility is an IVF cycle with ICSI. ICSI stands for intracytoplasmic sperm injection. In a standard IVF cycle, the sperm and the eggs are put into the same dish, and the sperm have to make their own way to the eggs. ICSI is an extra step where an embryologist will inject one sperm into each egg to try and give it the best chance of fertilization. This video shows a sperm being injected into an egg. A sperm has been taken up into the needle on the right-hand side of the screen. The needle is then inserted into the egg, the sperm is taken back into the needle to break the membrane of the egg, and the sperm is then injected into the cytoplasm. The needle is then removed from the egg, and the egg will be left overnight and checked for fertilization in the morning. The rest of the IVF cycle is the same as usual. If there are no sperm in the ejaculate, a small piece of testis can be taken and an embryologist can look for sperm in the tissue. If moving sperm are found, these can be injected using ICSI. If there are no sperm in the ejaculate or in the testicular tissue, a couple may consider using donor sperm. For a small proportion of men, their infertility may be caused by a reproductive hormone problem. If this is the case for you, your specialist will discuss this with you and may be able to give you some drugs to help sperm production. In summary, if you are worried about male fertility or have been told that you have a problem, it's best to maintain a healthy weight, do a moderate amount of exercise, eat a healthy diet, limit alcohol and caffeine intake, and definitely no smoking. And if you have any more questions, please see your fertility clinic.